going to be showing how to properly fit a wheelchair and then some safety precautions as well. So first and foremost, whenever putting a patient on a wheelchair or stopping or doing anything, we want to put that brake on. And then there's two, one on each side. Now I'm going to show how to properly fold up the wheelchair. So you're going to come here from the side, you're going to take the middle part of the seat, and it's just going to come right back up. And then you can use the sides to close it all the way properly, making sure you don't put your fingers in here or else they're going to get smashed. And then to open up the wheelchair, you're gonna come kind of here on that anterior side. And then this one's missing a handle, but you're gonna open it like so. Kind of from the sides of the seat. And then once it starts opening, you can take your hands like so, and then push it straight down. Okay, now I'm going to be educating my patient, Efren, on how to properly use a wheelchair. So first and foremost, I will instruct him to make sure the brakes are on. So you want to make sure the brakes are on. So they're going to be one on your left, and then you can grab the one on your, or my right, your left. And then they will take a seat. Okay, so making sure for repositioning purposes, if a patient is on a wheelchair for a longer period of time, their scapula, their olecranon processes, and their ischial tuberosities can get skin breakdown if they're not properly moving. So we can put a pillow under for comfort, so I'll have you stand up. And then you can place a cushion here on the seat, and you can take a seat. And that will help prevent any breakdown of the skin on the buttock area as well. And in addition, we can also put pillows or rags underneath the elbows to help with any breakdown of the olecranon processes on both sides. And then we also have leg rests for patients as well. So there's a right and a left. So I'm going to instruct how to put those on. So these little guys come in here. There you go. And then you want to make sure you hear that click. And then that patient, I'll have him bring them up. There you go. And then we're going to go on this side. Make sure it clicks. There we go. And then put your foot there. And then that's for the leg rest. And then I'm going to show you how to take them off. So you'll instruct the patient to bring their foot down onto the floor so it won't get caught. And you're gonna take this silver little latch here and pull it towards you. That gets the leg rests away from each other if the patient needs to stand up out of the wheelchair. And then to take them off completely, you just take it out of that little space there. So do this other side, I'll have you pick up your leg. It's gonna go on the floor. Same thing, pulling this latch towards me, and it comes right off. So first off, to begin the proper wheelchair fit for a patient, you're going to instruct them to sit erect in the chair and make sure that pelvis sits right against that backrest. That's the first one. The foot plate must be at least 2 inches from above the floor. So here's the foot plate. Here I have my measuring tape. So at least 2 inches. For us, it's about 3.5. So that is the proper. Now I'm going to be measuring the leg length, lower leg length. So I'm going to measure from his heel to his popliteal fold, and then add 2 inches to allow clearance of foot support. Okay, so inches. So we have heel. Popliteal fold about 18, so then 19, 20. Okay, so now to measure for proper seat depth, we're gonna have your hand parallel to the floor, and you should be able to place the width of 2 or 3 fingers between that front edge of the wheelchair and then their popliteal fold. So are you seated nice and upright?
Yes.
Good. So for me, I have at least, say, 2.5 fingers in between the front edge and the popliteal folds. Okay, now I'm gonna be measuring the buttocks and thigh depth for a wheelchair. So I'm gonna measure his posterior buttock on the lateral side to the popliteal fold, and then I'm going to subtract 2 inches. So, is it okay if I
Yes.
come down here? Okay. So I'm gonna get a little personal here. And I'm gonna go to your popliteal folds. About 19 minus 2, so, and that's 17. So we wanna do this to avoid pressure from the front edge of the seat against that popliteal space. Now I'm gonna be measuring the hip width of the seat. So what you're gonna do, you're gonna place your hands vertical, and then you should be able to clearly put your fingers in between their thighs and then the edge of the seat. So mine are a little snug, so he'll definitely need a little bit of a wider seat for a proper fit for the wheelchair. This seat is a little too snug, so in order to get that accurate measurement of what number, how many inches the seat, the hip width needs to be, you can take your tape measure and you're gonna measure the most lateral part of the user's buttocks or thighs. So what I'm gonna do, we're gonna go from one edge to here. About 21, and then it's said to add approximately 1.5. So it's going to be 22.5 inches for a proper hip width seat. So for the proper back height for a wheelchair fit, you should be able to place the width of 4 fingers in between the top of the upholstery and in the axilla. So we know that this width of seat is a little too small for my patient, so his axilla is all the way over here and the upholstery's here. So therefore, this is not a proper back height. I'm going to observe the angle made by the posterior aspect of the arm and the back post when his elbow is at rest. He is making sure that your trunk is erect and he's seated all the way back. Okay, so what we're gonna do is we're going to measure from the back post to the elbow, and it should be at approximately at least 4 inches, and for him it's about 5.5, so we're good. Okay, so we can observe that my patient does have longer arms, so when his elbow is flexed to 90 and his shoulder is at 0, that arm rest is sitting a little bit too high above where it should be to be comfortable. Thanks for watching.